Hi, I'm Congressman Steve Scalise. Here in Washington, we're in the middle of a very intense debate on health care. Now, this is an important issue, but let's talk about President Obama and Speaker Pelosi's bill to try to create a government takeover of our health care system, which I strongly opposed. Now, first of all, President Obama talks a lot about if you like the health care you have, you can keep it. Now, I'm a strong believer that if you like your health care plan, you should keep it. Unfortunately, I don't think President Obama's read Section 101 and 102 of the bill, where literally they give the power of this new health care czar to take away your health care, even if you do like it. A lot of times President Obama has said anybody making under $250,000 a year will not pay any new taxes. Again, maybe President Obama did not read Section 401 of his own bill, where they allow and set up this tax on individuals without acceptable health care conditions. Meaning this health care czar can literally tell you, even if you have health care, that it doesn't meet this new government standard, and they can tax your income. It's right here in this bill. Another thing we've heard a lot about from the countries like Canada and England that have government-run health care is that they ration care. And it's a big concern of mine. Unfortunately, here in their bill, right here on page 965, they give this new health care czar the power to ration care for senior citizens and others. This is an organizational chart of their bill. Now, if you look at all of the new government bureaucrats that they create, I think the most important relationship is that relationship between the patient and the doctor. And look at all of these new dozens of federal agencies that they're putting in between the doctor and the patient. This isn't the right approach to healthcare reform. On their bill, we had actually filed a number of amendments to address some of these problems. We had an amendment to say the government can't interfere in the relationship between you and your doctor. Guess what? They defeated that amendment. We even had an amendment that said, if this is such a good plan, all members of Congress have to join that government plan. And sure enough, Speaker Pelosi and her liberal lieutenants even defeated that amendment. I think there's a much better way. We can reform the problems that exist without breaking the things that make our medical care the best in the nation. I'm proud to be a co-sponsor of a bill here that provides alternatives and actually addresses the problems to make healthcare more affordable and more accessible for American families. We create tax credits to make healthcare more affordable for American citizens and lower the cost. We create association health plans so that small businesses can pool together and actually get the buying power of a large business so they can reduce the cost and provide health care for their employees when many of them can't afford it today. We even address a number of other issues like pre-existing conditions. I don't think it's fair that a person who's battling cancer or any other disease is able to be discriminated against like they are under today's healthcare system because they have a pre-existing condition. We address that problem in our bill too. Obviously, there's a much better way than this government takeover by President Obama and Speaker Pelosi, and I'm asking you to get directly involved. You can email us at controlspending@mail.house.gov or call President Obama and Speaker Pelosi and let them know your thoughts on this issue. I appreciate you taking the interest.